Hi everyone, my name is Melanie Grant, and this is C&M Glass. Today we're talking about our second part of Anesthesia Coding and Coding Clinic Review for our class 2030. So I'm combining a couple of the concepts that we talked about in Coding Clinic, as well as some of the review of some examples with anesthesia, which I've put on the board and I'll be working with you. Our key points that we're going to talk about are crosswalk, which I've given you a sample here, how to look up base units, which I've given here, and some of the details with the modifiers and qualifiers that you'll find in your anesthesia cheat sheet in this week's learning module. Okay, so let's get started. The first thing I want you to do is make sure you read the PowerPoint with all of the section notes and all of the comments, because I've broken down anesthesia coding all the way down to each level. You'll notice that the PowerPoint does say Elsevier because I did borrow some information from a previous class, and I wanted to give them credit for what they had provided to us. However, all the detail in there I verified, and it should be accurate and very precise to what you're learning this week. The next thing you want to look at is take some time to download and save a copy of the sample crosswalk, the link for the base units, which is all the 2018 base units as printed by CMS. According to this year's research, CMS has not changed any of the base units for anesthesia. And then you have your anesthesia cheat sheet that I've put together, which has all of the qualifiers, all of the modifiers, and all of the units. So, couple of things to get started. Anesthesia, if you've already watched video number 1 or have already done some of the work for this week, you'll know that anesthesia is very unique, and it can link you can look up anesthesia codes directly from your code book, or you can link them to the actual code of a procedure in order to determine the correct code. The first thing that you want to know when coding anesthesia is that you code it with the term anesthesia, and then by body area. And this is anatomically correct from head to toe, just like some of our other areas. Okay? The other thing you want to be aware of with anesthesia coding is some of it's very vague and very specific to the area, but not really specific to the surgery, or it's more anatomically referenced. For those of you that are taking PCS or have already taken it, you may notice some similarities in how that's organized because it's going based off of the area, and you want to pay attention. Are we looking at skin? Are we looking at what part of the body that we're looking at specifically? Okay, the other thing though, and what most coders that work in anesthesia do, is they use an anesthesia crosswalk. Now this is a separate book, separate of your CPT book, that will provide you with a CPT code for a procedure and all of the anesthesia codes that may relate to that procedure code. Because some procedures are to multiple areas based off of the location within the body that it goes to, you'll notice that there's several codes. Let's get started. To begin with, I want to look at these 3 samples here, pulled directly from the sample crosswalk that's in this week's assignment. You'll notice that CPT code 11055, always make sure you have dashes through your zeros, by the way, in order to identify the difference between a numeric and alphanumeric code. Okay, so 11055, if I look in my CPT book, this is a procedure for paring and cutting of benign hyperkeratonic lesions. And they give some examples such as corns or calluses. And this is a single lesion versus 2 to 4 lesions for 5-6. If I look at 11305, I have shaving of an epidermal or dermal lesion, single lesions of the scalp, neck, hands, feet, genitalia. Okay, and that's for lesions that are 0.5 centimeters or less. It's not very often that you're going to have anesthesia for these kind of procedures, but we could presume that maybe a patient has behavioral issues. In fact, let's go ahead and say that we have a child who is under the age of 1, and let's say 6 months old, with lesions. And so for that reason, we would have a patient needing anesthesia. Is this going to be common? Not really, but for the purpose of today, we'll say that it is. Okay, so we have a 6-month-old with, remember that the C with the line above it is a shorthand in medical documentation that means with, a lesion. And we'll say it is to the feet. Okay? We'll even say right foot. And we had one single lesion. Okay. Documentation review of it said that this was cut off under anesthesia. And that's under anesthesia due to the extreme age of that patient. Okay, no other complications, no other details. This is what you pulled out. And let's say that the anesthesia was done by the CRNA at direction or supervision of the anesthesiologist. Okay, so now we're ready to code. The first thing you want to do is determine the CPT code. When you're using a crosswalk, determine the CPT code for the procedure that was performed. In this case, 11055 is your CPT code. Okay? Now, this one I decided on purpose to give you a little bit of a trick, and I'm going to show you why in just a moment. 11055, you'll notice, has two anesthesia codes. You have 00300 and 00400. With some of your anesthesia crosswalk codes, there's going to be a direct anesthesia code for that surgery, and others, there may be more than one. Because this was a sample, it actually doesn't include all of the possible codes that we might use. Okay, so let's look at that. 11055. We have our procedure, we have our anesthesia codes, and now we want to look at those to determine which is proper, or are these proper for our surgery. Okay, so we're going to go to our anesthesia section to look at both of the anesthesia codes in the crosswalk. For 00300, I see that this is of the neck. Anesthesia for all procedures on the integumentary system, muscles and nerves of head, neck, and posterior trunk, meaning the back, not otherwise specified. So I know that if a lesion is removed from the right foot, that's not going to be the head, neck, or posterior back. I'm going to keep going. For the next one, 00400, anesthesia for procedures of the integumentary system on extremities, anterior trunk, and perineum, not otherwise specified. In this one, I can see that extremities is referencing the limbs. Now, one thing I want to take you to, if you look up anesthesia and you were to look up the foot, you may have found yourself in 01462, which you'll notice is not on the crosswalk. 01462 is anesthesia for all closed procedures on the lower leg, ankle, and foot. What is the difference, and how do I know which of these two codes to look at? Because if I had gone to our back alphabetical and just looked up anesthesia, and then said anesthesia for procedure to the foot, I would have found 01462. And that one would have been incorrect because the procedure is not to the actual foot, but to the skin. Okay, so when we're cutting a lesion off of the foot, in this case, procedure 11055 is an integumentary procedure. And you will need to go back to your anesthesia crosswalk and pay attention to that, because this is the procedure on the integumentary system. And if you look at 00400, on the extremities is included. So we're going to list this as our code, 00400. Okay. And I'm going to erase some of this here so we have a little bit more room for us to write. Okay, so that's step one of anesthesia coding. Find the anesthesia code and verify that it's in the correct area for your procedure. Our next one that we want to look at is, how do I bill units for anesthesia? Now let's say that this patient was under for 45 minutes, because we do need to look that up. And keep in mind, you want start to stop time for anesthesia, not start and stop time for the surgery. Okay, that's very important. So I have a 6-month-old with a lesion of the right foot that was cut off under anesthesia for 45 minutes, administered by the CRNA with direction of the anesthesiologist. And for this part of my coding, I'm going to keep my anesthesia quick reference sheet available, because that's very important for me, because it has all of the modifiers I might need. I like to start with modifiers first and then go back to base units. So we're going to pause on base units for a minute and let's talk about qualifiers and modifiers. Okay? The first thing you want to know is that anesthesia always has two modifiers. A modifier for who provided the anesthesia and a modifier for the patient's status. These are your P modifiers or your Q, G, and A modifiers for the procedure itself. And in this case, we have a CRNA under direction by an anesthesiologist. Okay? Now in this one, I'm going to look here and I'm going to see I have a couple of options. Anesthesia by the anesthesiologist is not correct. I'm looking at the anesthesia quick reference cheat sheet. I'm not sure exactly how well that shows up on the video, but you should pull it up on your own as you're watching this video. Make sure to have a printed copy of it because you will be using it this week in your coding. I have physician and medical supervision. I have monitored anesthesia care for complex procedures. I'm just going to scroll down for those. I have CRNA directed by a physician, and then monitored anesthesia care, anesthesiologist directing one CRNA, CRNA without direction. Let's see. And then a MAC, anesthesiologist directing CRNA. So in this case, this should be an MAC. I didn't indicate that, but you would want to look at that. So in the actual instance, the anesthesiologist is monitoring. It's going to fall under a CRNA at the direction of anesthesiologist, and that's an MAC. So that was missing from our little reference here. And for that one, we're going to use modifier QY to indicate CRNA that's being directed by the anesthesiologist. And again, this may not be exactly appropriate. There may not be a need for the anesthesiologist to observe the CRNA. Most likely it was the physician, but as we were writing it down, that's what we decided it was going to be. So just kind of a little bit of differences between classwork versus real life and what actually does happen, but can still happen in this example. Okay, now another thing to keep in mind, it doesn't matter which order you put the two modifiers you have to have listed. So if I use my modifier to indicate who provided the anesthesia, or if I use the patient status modifier first, that's perfectly fine. I typically like to do the patient status modifier first. There will be some insurance companies, however, that have a very specific preference, and in that case you want to follow it. For us, it's not as important. Okay, the next thing we want to look at is our P status modifiers, and we have this on our anesthesia cheat sheet. And we have the difference of P1, a normal healthy patient, P2, a patient with a mild systemic disease, a P3, a patient with severe systemic disease, P4, the severe systemic disease that is a constant threat to life. A 5 is a patient not expected to survive without this operation. So they have to do an operation, more likely an emergency situation or something that their heart is failing and they have to have this surgery. And then of course your P6 is for patients who are considered brain dead to make sure that they don't actually wake up during the surgery, because while we do consider them brain dead, nobody is perfect, and medical miracles, unfortunately, happen at the worst of times. In that instance, nobody would want to wake up to that. So those are your status modifiers. This patient here is given, just has a lesion of the foot. There was no additional conditions that would indicate that they had any systemic diseases or surgery was emergency or required. So this is a P1. Okay, so that's how you're going to write your anesthesia code. Now, the last thing you want to do is you're going to indicate the units for the anesthesia, and this is for payment purposes. So we're going to say times, and now we're going to determine, well, how do I know how many units to do? Okay, so I'm going to switch over our colors here. Now, this is where we're going to look at the very easy calculation of B plus T plus M. Base units plus time plus any modifying qualifiers, okay? So the first thing I do when I'm looking at the M is I determine what is my base units for code 00400. I go to my base unit reference, which is in a Excel sheet, and I see that it's 3. So I'm going to say 3 base units plus. Then I'm going to look at the time. And time is divided by the amount of minutes in 15-minute increments. So I have 45 here divided by 15 is equal to 3. So I'm going to say my original statement was 3 plus another 3 because I had 3 sets of 15 minutes in a 45-minute time frame. Then what I like to do is I like to add each of my qualifiers individually. So I look at my P1 qualifier, that's 0. So I can add, just for purposes of making sure we cover everything, I like to add it to make sure, did I add the P1 or the patient status? Yes, I did. And then our last one we're going to look at is any qualifiers. So these are the 4 add-on codes here. And you'll look at those and you'll see that the qualifiers are 99100 for patient of extreme age, either younger than a year old or older than 70. In this case, yes, the patient is 6 months old. So now I'm going to not only add a 1 for that, but I'm also going to add code 99100 times 1, because that just got added on since the patient is of extreme age. Other qualifiers for patients that are experiencing body hypothermia, so they're freezing, hypotension, their blood pressure is very low, or they're complicated by emergency conditions. So none of those apply. So now I'm ready to add these all together, and I'm going to have 7. So when I go back to my code, I'm going to have 00400-QY-P1 times 7. Okay. Last thing to keep in mind before we break from this video, I want to talk to you a little bit about patient statuses. So one of the questions I have is, how do I identify if a patient has a systemic disease? A systemic disease is any kind of chronic condition that the patient has that affects their entire body. And the reason that these are important for us to identify is because anything you do for anesthesia, you're lowering the blood pressure. And if they have something like hypertension, where they're already on blood pressure medications, it's important that the provider is able to take that into consideration and taking them off of those medications before they start anesthesia. Likewise, with diabetic patients, they may have uncontrolled sugars, which causes them to have various complications. And in the instance that could complicate anesthesia, you're going to be looking at the difference between mild or an uncomplicated, which is severe. So how do you know the difference? If they have a systemic condition, meaning any condition that can affect the entire body, even if it's controlled, then it's going to be a P2 for your patient with mild systemic conditions. If they have uncontrolled or documented as severe conditions that are systemic, you're going to be P3. And it has to be documented as a constant threat to life to be a P4. A patient with cancer, for example, does not have a systemic condition that is a threat to life, because the cancer, while it does threaten the patient's life, is not constantly threatening them. They're not always at that point where this could kill them right this second, and cancer is not always systemic. So always keep those things in mind when you're determining your P modifier. That's all I have for this week's second part 2 of anesthesia and our coding clinic, Coding with Miss Melanie. If you have questions throughout the rest of the week and you want to send those over to me, go ahead and send them to my email, or you may text me for any emergency situations that you come across throughout the week. We'll talk to you next time. Take care.